Welcome to part 21 and 22 of chapter 2. This is our last two parts, and both of them are kind of short. And we'll be going over stressful situations and uncertain situations in this section. Well, just being part of EMS just itself is stressful. We come to work every day and we never know what we're going to be called to do at a moment's notice. There's no schedule for MVCs or heart attacks or difficulty breathing calls or whatever. So this can cause a bit of stress for all of us. However, some situations cause more stress. For instance, a mass casualty event. Those are very stressful for everyone involved, including the patients. And one thing I want you to remember is that it doesn't matter if it's a mass casualty incident or a single incident. That incident is stressful for the patient and their family as well. Even if you do not feel like it's an emergency, there's a bit of stress going on there. And you have to be the professional. And you have to be the one that comes in with a calm demeanor that acts professional and is able to calm the chaos and help the patient and their family the best way possible. So with that being said, you want to use extreme care in the words and actions that you use. Don't be aggressive, be gentle, be open, and be kind. So always be professional. Balance your compassion and professional judgment. Sometimes they may conflict, but you have to do what is right for the patient at the end of the day. Give patients the opportunity to express their fears. Don't tell them it's all going to be okay or it's not going to hurt when it's not going to be. Allow them to be, emotional. You don't have to tell them to be quiet. I've seen people tell them, hey, you just need to be quiet and get over it or whatever. That is completely unacceptable. And I'll tell you, when you do things like that, it will come back to bite you because family members will complain. I've seen people in this profession, unfortunately, get away with a lot of things. But the thing that I see people get terminated for or let go the most is being rude to patients and patient families. That's something that is not excusable in our profession. So don't get in the habit of doing it. And don't let the stress get to you. Remember, we talked earlier about ways that we can relieve stress. If the stress is starting to get to you, that's the time for you to go take a day off. Ask for help. Go exercise. Get a breather for a little bit. So whenever we have a situation or a call or an incident, and if you have like the elderly patients or if you have children involved, it's best to transport with the parents or with other family members. The only thing is, when you are transporting other family members or friends or anyone else in the ambulance that's not the patient, you need to make sure that they're in a secure location and follow your local protocols or your business or your company's standing operating procedures on this. If you allow the parents to ride in the back of the ambulance, then you need to make sure they're wearing their seat belt and that they are properly secured in. If not, they need to be up front properly secured in, because if they're injured, you could be held liable for their injuries. Some places do not allow parents or anyone other than the patient to ride in the back. I've worked for organizations that would not allow anyone else except for medical providers to ride in the back with the patient. It didn't matter if the patient was 1 year old, 1 month old, or 100 years old. The only person that could ride in the back of the ambulance was the medical providers and the patient. Everyone else had to be up front. Now, with that said, you would think, oh, that's going to cause a lot of problems, and it really didn't. If you approach it and you explain to the family why, and if you make it where the family is accessible to the patient, then it's a lot easier. I have set it up because in the ambulances that we had the microphones that would work inside the ambulance where the family could hold the the radio and the handset, and they could talk to their children or their family member in the back directly. And I also would leave the door open so they could turn their head and look and see that everything was fine. And those are things that you want to do if that is your situation. But regardless of whatever situation it is, you need to make sure that they are secured in the vehicle and properly secured and safe. Respect religious customs and patient needs, and you want to do this to the best of your ability. But remember, patient care comes first, but you do not want to disrespect them either. But if you see some abuse going on or anything, despite it doesn't matter what it is, you want to report it, because if it is not abuse, well, then the people who investigate it will find out that it's not abuse and everything will be fine. So make sure you do that. And in the event of death, you want to make sure you handle the body with the respect and dignity. That cannot be overemphasized, because I know if it was my loved one, I would want everyone that's charged with taking care of them to respect them. So that sums up, that just finishes up this section on stressful situations, and next we're going to get into uncertain situations, which is going to be very short. Which this happens all the time. It's almost on a daily basis. You know, whenever we get a call, we're not real certain of what we're getting into until we actually get there. And sometimes even when we get there, we're not certain what's going on. So if you do get there and you find that there's no clear indication that there's a true emergency going on, you might want to contact medical control and talk to them about transport. And follow your local protocols as well, because some places have a treat no transport policy, but some have a transport everybody policy. I'm on the fence about which one's right. I am real skittish about telling someone they don't need to go to the hospital, because you have to realize we do not have all the diagnostic tools that can really drill down to find out if there's something wrong with somebody, and only that person can really know if they're, how they feel. We can only assume how they really feel, and really a physician and the equipment and the labs and everything they have in the hospital is really the only way you can really drill down to see that if anybody is going to be definitively okay. Just remember that minor signs may be early indicators of severe illness or injury, and if we transport them and get them to the hospital, well, then that could possibly, whatever's ailing them could be found soon enough so that they could have a quicker recovery and less side effects from it. Also, remember this too about children. Sometimes children can have an episode of like not breathing, or they can have seizures or something before we get there, but then when we get there on scene, they may seem fine. Everything may seem okay. It's called an ALT, an acute life-threatening event, and that ALT may pass by the time we get there, but then if we get a refusal and leave, then it could happen again, and the next time they may not wake up, or things may not go as positive. So it's good to err on the side of transporting, especially if you're in doubt. Get them to the hospital, get them checked out. My saying is, I'd rather you have a bad day sitting at the emergency room, in the waiting room, or in a room getting diagnostic tests done, and the doctor say, hey, you're fine and you can go home and everything's okay and we all know for sure. But however, what I don't want to happen is for me to leave you at home and something be wrong, and then I have to come back later to find you in a lot worse condition and possibly even dead. And that's the last thing we want to happen. Well, this concludes Chapter 2. Chapter 2 was a long one. If you have any questions or anything, please feel free to give me a call. You can contact me. My contact information is in the course room. Also, please feel free to review these slides often, and we will keep moving forward. Next will be I don't forget what chapter it is next, but it will be pharmacology. I think it's chapter 7. So if you have anything, please let me know, and thank you for your time.